नमस्कार, सत श्री अकाल। वैस्टर्न न्यूज़ देख रहे जी पंजाब के दर्शकों का स्वागत है। मैं हूं जल सतनाम। बुलेटिन की शुरुआत में नज़र पा लेने कुछ अहम खबरों ते। ओबामा ने हैल्थ केयर एक्ट के फैसले को जनता की जित करार दिता। रोमनी ने इस एक्ट की की आलोचना। यूरो खेतर लिए 120 मिलियन यूरो खर्च करने ते बनी सहमति। यूरो को बचाने लिए ब्रसल्स में विचारां। यूनेस्को वालों माली के तिम्बकटू शहर को विश्व विरासत का दर्जा। अलकायदा कारण तिम्बकटू की विरासत को खतरा। हुण खबरां तफसील नाल। अमेरिकी राष्ट्रपति बराक ओबामा ने कहा कि सुप्रीम कोर्ट का अफोर्डेबल हैल्थ केयर एक्ट के पक्ष में दिता गया फैसला अमेरिकी जनता की जित है। सुप्रीम कोर्ट के इस फैसले को नवंबर दीआं राष्ट्रपति चोणां तो पहलां ओबामा के पक्ष में वड्डी जित मन्निया जा रहा है। व्हाइट हाउस के ईस्ट रूम तो ओबामा ने कहा कि राजनीति जो भी होवे, ये फैसला पूरे देश की जनता की जित है, जिहड़े हुण इस कानून के जरिए ज्यादा सुरक्षित होणगे। सुप्रीम कोर्ट ने इस कानून के पक्ष में फैसला दिता है। ओबामा ने कहा कि वह इस कानून को अमल में लियाउण दीआं कोशिशां जारी रखणगे। उन्होंने कहा कि वह इस दे सुधार लई काम करते रहणगे।
The Supreme Court upheld the constitutionality of the Affordable Care Act, the name of the health care reform we passed 2 years ago. In doing so, they've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin. I know there will be a lot of discussion today about the politics of all this, about who won and who lost. That's how these things tend to be viewed here in Washington. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can. But what we won't do, what the country can't afford to do, is refight the political battles of 2 years ago or go back to the way things were. With today's announcement, it's time for us to move forward, to implement and, where necessary, improve on this law. And now's the time to keep our focus on the most urgent challenge of our time, putting people back to work, paying down our debt, and building an economy where people can have confidence that if they work hard, they can get ahead. But today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.
रिपब्लिकन पार्टी के राष्ट्रपति अहुदे के उम्मीदवार मिट रोमनी ने वोटरां नूं अपील की है कि वह अमेरिकी राष्ट्रपति बराक ओबामा नूं हराउण विच उन्हां दी मदद करन। सुप्रीम कोर्ट वालों हैल्थ केयर के पक्ष च दिते फैसले बारे रोमनी ने कहा कि जेकर वह चोण जित के सत्ता विच आए तो वह इस कानून नूं रद्द कर देणगे।
I disagree with the Supreme Court's decision, and I agree with the dissent. What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday, it's bad policy today. Obamacare was bad law yesterday, it's bad law today. Let me tell you why I say that. Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations. Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep. Obamacare is a job killer. Businesses across the country have been asked what the impact is of Obamacare. 3/4 of those surveyed by the Chamber of Commerce said Obamacare makes it less likely for them to hire people. And perhaps most troubling of all, Obamacare puts the federal government between you and your doctor.
ਸੁਪਰੀਮ ਕੋਰਟ ਵੱਲੋਂ ਰਾਸ਼ਟਰਪਤੀ ਬਰਾਕ ਓਬਾਮਾ ਦੇ ਹੈਲਥ ਕੇਅਰ ਪਲਾਨ ਬਾਰੇ ਅਮਰੀਕੀ ਲੋਕਾਂ ਦੀ ਰਾਏ ਵੱਖੋ ਵੱਖਰੀ ਹੈ। ਸੁਪਰੀਮ ਕੋਰਟ ਦੇ ਫੈਸਲੇ ਮੁਤਾਬਕ ਹਰੇਕ ਵਿਅਕਤੀ ਨੂੰ ਸਾਲ 2014 ਤੱਕ ਬੀਮਾ ਪਾਲਿਸੀ ਲੈਣੀ ਲਾਜ਼ਮੀ ਹੋਏਗੀ, ਨਹੀਂ ਤਾਂ ਉਹਨਾਂ ਨੂੰ ਪੈਨਲਟੀ ਭੁਗਤਣੀ ਪਏਗੀ।
They should have health care insurance. They should say, we all should. Everybody should have health care insurance. And if you don't have it, I shouldn't have to be responsible to pay for it when I have it. That's constitutional for my rights also. So, good job.
I do not believe universal health care is the answer. I do not believe that government-run health care is the answer. I believe personal responsibility is the answer. I believe that people need to be armed with choices and tools in order to make an intelligent decision. And the government should not be involved in it, nor should the government be telling me what I should purchase. They have no right to be in my life in that way, despite what Justice Roberts says. So with all of that, I would say to you that in many ways, I'm almost happy that the court didn't have to do that. That was the easy way out for those of us who are against it. I'd much rather see the people now in November make a resounding decision to fight this together.
I think that there is a major problem in the United States relative to the way that the healthcare system works. As far as the ruling is concerned, I think it's a pretty good ruling that everybody should be entitled to healthcare. Healthcare should not be a commodity or a luxury. It's a basic need of human being, and I think the ruling is pretty good.
I think that's going to kill us in our economy. I think it's going to be a really bad thing for our economy because I don't know how we're going to afford to pay for it. We can't afford for what we have. And the people that can pay for it are going to pay higher prices.
I don't know the exact numbers, but it's billions of dollars that hospitals are charging folks who do have insurance for those people who don't, because they're obviously going to care for those who have health care. So you have to pay on graduated sort of costs for whatever your income is. It's important that everybody's covered. I think it'll eventually bring down the cost.
It's a good thing. It's good. Why people should pay for things that they need, you know? That's the way I see it.
ਅਲਪ ਸੁਵਿਧਾ ਪ੍ਰਾਪਤ ਲੋਕਾਂ ਨੇ ਅਮਰੀਕੀ ਸੁਪਰੀਮ ਕੋਰਟ ਹੈਲਥ ਸੰਬੰਧੀ ਦਿੱਤੇ ਫੈਸਲੇ ਤੇ ਰਾਹਤ ਜਤਾਈ ਹੈ। ਨਿਊਯਾਰਕ ਸਿਟੀ ਦੇ ਨੇੜਲੇ ਘੱਟ ਆਮਦਨ ਵਾਲੇ ਕਮਿਊਨਿਟੀ ਹਸਪਤਾਲਾਂ ਵਿਚਲੇ ਮਰੀਜ਼ਾਂ ਨੇ ਬਰਾਕ ਓਬਾਮਾ ਦੀ ਹੈਲਥ ਪਾਲਿਸੀ ਨੂੰ ਸੁਪਰੀਮ ਕੋਰਟ ਵੱਲੋਂ ਪਾਸ ਕੀਤੇ ਜਾਣ ਦੀ ਖੁਸ਼ੀ ਮਨਾਈ। ਉਹ ਅਮਰੀਕੀ ਜਿਹੜੇ ਆਪਣੇ ਮੈਡੀਕਲ ਬਿੱਲਾਂ ਦਾ ਭੁਗਤਾਨ ਨਹੀਂ ਕਰ ਪਾਉਂਦੇ, ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਹੁਣ ਉਹ ਹੈਲਥ ਪਾਲਿਸੀ ਨਾਲ ਸਭ ਨੂੰ ਰਾਹਤ ਮਿਲੇਗੀ। ਘੱਟ ਆਮਦਨ ਵਾਲੇ ਅਮਰੀਕੀ ਲੋਕਾਂ ਦਾ ਮੰਨਣਾ ਹੈ ਕਿ ਹੈਲਥ ਪਾਲਿਸੀ ਹਰੇਕ ਲਈ ਲਾਜ਼ਮੀ ਹੋਣੀ ਚਾਹੀਦੀ ਹੈ।
Well, it's important because everybody needs health care. You don't want to have a person get sick and not go for help, and then it makes matters worse. I mean, especially in this neighborhood, especially in the Bronx, I mean, there's a lot of people without health care that are sick that don't want to go because they're scared they won't get paid for or they'll be billed. So that will help out a lot of people.
Majority cannot actually afford the right health care they need. So if there's a way of subsidizing health care for everybody, I think it's a welcome development. I mean, everybody needs health care. Everybody has the right to be healthy.
It's just a human right to be taken care of. Now that we have the technology to do so many things and reach out to so many people, why not be able to do that and cut somebody off who doesn't have enough money? I think that's just morally wrong, in my opinion.
Like the government has to help everybody to go to hospital, you know, for the insurance, because there is no job like before. So the government must help.
It really is, it's like a tax, but it's not a tax. What it is it's really what it's been called. This is an individual responsibility payment. Look, if you have health insurance or you can't afford health insurance, this law says you're fine. We're not going to bother you. It's just going after that small slice of people who can afford health insurance but don't buy it, trying instead to just rely on the emergency room when they get sick. That imposes costs on the rest of us, and they need to pay to offset those costs.
Universal coverage, providing coverage to everyone, giving them access to primary care, and encouraging them to gain access to it, having it aligned with social policy around the things that make the most sense for prevention, that will reduce cost over time, because those patients won't wind up in the emergency room. They won't wind up having the sort of tertiary and quaternary services that are required. Many of them won't anyway, because they'll be better cared for early in the process. That's both good medicine and good business.
ਖਬਰਾਂ 'ਚ ਹੋਰ ਵੀ ਨੇ, ਪਰ ਇੱਥੇ ਰੁਕ ਰਹੇ ਹਾਂ ਇੱਕ ਛੋਟੇ ਜਿਹੇ ਬ੍ਰੇਕ ਲਈ। ਤੁਸੀਂ ਬਣੇ ਰਹੋ ਜੀ ਪੰਜਾਬ ਦੇ ਨਾਲ।